Thank you for choosing Westmead Fertility Centre, a subsidiary of the University of Sydney. The Westmead Fertility Centre team includes highly skilled embryologists, experienced nurses and counsellors, and helpful patient support staff who work alongside our leading fertility specialists, so you can rest assured you will be in safe hands with our expert team. This video will tell you what you need to know before you embark on your treatment with us. We understand you may have a lot of questions as you move through your treatment, and our team will always be here to give you the information that you need.
The best way to contact us is by logging into the patient portal at www.westmeadfertilitycentre.com.au.
After we have registered you as a patient and you have verified your email address with us, registration details for the portal will be emailed to you before you start treatment. If you don't receive the registration email, please give us a call and we will get it sorted out for you. The registration email will also contain a link to an instructional video showing you how to navigate around the portal. Each time you need to contact us to either give us some information or to ask us a question, log your query on the patient portal and one of our dedicated team members will get back in contact with you as soon as possible. Please also follow this process to let us know it is day 1 of your cycle, and one of our nursing team will contact you to get your treatment started. There may be times when your query is more urgent, so if during your treatment you have concerns about your medication, are experiencing increasing pain, nausea, vomiting or shortness of breath after egg collection, or bleeding and pain in early pregnancy, call us directly on 02 8890 7484 so we can assist you immediately. If these symptoms arise outside of business hours, call Westmead Hospital on 8890 5555 and request contact with Westmead Fertility Centre's on-call consultant. Of course, if it is a medical emergency, present to your nearest emergency department or call 000. At your first visit to our clinic, present to the reception desk and our admin team will issue you with your access card. Each time you visit our clinic, please scan your card to alert our team of your arrival. After you have scanned your card, please take a seat and our staff will attend to you as soon as possible. The patient self-check-in station is located just as you enter the centre. We are committed to offering affordable pricing and broad access to quality fertility treatment. You will not require health insurance to access services at our clinic. Our centre is the only clinic in New South Wales offering all-inclusive pricing for treatment, including all costs for your treatment cycle, theatre and anaesthetic fees, as well as freezing and storage of embryos for up to 2 years. If you are eligible for Medicare support for your treatment, it is important that you have a valid GP referral to one of our fertility specialists. This must be valid and dated on or prior to day 1 of your cycle.
To ensure you receive all possible Medicare rebates and therefore the lowest out-of-pocket costs, prior to commencing treatment, you should check with Medicare that you and your family are correctly linked in their systems. This will maximise your entitlements under the Extended Medicare Safety Net (EMSN) scheme. If you are not eligible for Medicare, please talk to one of our team for more information.
From a Medicare point of view, a cycle starts on the first day of your menstrual cycle, or as soon as you start taking stimulation drugs, and continues through to the embryo transfer. Your fertility specialist will work with our team of nurses and embryologists to determine the best course of treatment for your own circumstances. Sometimes, to ensure patient safety and the best possible outcome, a cycle may end before embryo transfer. There are various reasons for this, and should this happen to you, our team will explain the specific clinical reasons applicable. This may result in the cycle being considered cancelled, in which case most of your fee will be reimbursed to you by our clinic, with Medicare reimbursing you for the remainder. Sometimes, the best course to maximise your chance of success is not known until your eggs and sperm are collected. This may result in a change in the method of fertilisation from in vitro fertilisation, IVF, to intracytoplasmic sperm injection, ICSI, where the sperm are injected into the egg. ICSI involves more of our embryologist's time, and an additional charge will be payable for this extra treatment, most of which is covered by an additional Medicare rebate. Some cycles will have the best possible outcome if all embryos are frozen before transfer. In this case, there is no fresh embryo transfer and all embryos will be available for a subsequent frozen embryo transfer cycle. FET cycle costs are not included in the upfront IVF/ICSI cycle fee and involve the start of a new cycle that ends when the frozen embryo is transferred. Our clinic requires upfront payment of all fees. Our administration team will email you an invoice that will detail our available online payment methods and the amount that you are required to pay. The final out-of-pocket costs quoted to you presume that all ultrasound and blood testing is conducted within the facilities of our clinic. Any blood tests or ultrasound scans that you choose not to have done at our clinic cannot be bulk billed, and you will incur costs for these tests in addition to the out-of-pocket costs quoted by our team. Your doctor will provide you with the prescriptions you need for your treatment. If you don't have a script, please contact your doctor directly. You will need to purchase prescription medication for your treatment, most of which are available on the Pharmaceutical Benefit Scheme, PBS, and are available to you at a subsidised rate. In addition to keeping our pricing affordable, our clinic also offers eligible patients access to a gap payment for IVF, ICSI and FET cycles. The value of the gap payment required from eligible patients is equivalent to the out-of-pocket expenses after Medicare rebates. Your account with our clinic will be settled once you supply the Medicare rebate check to Westmead Fertility Centre. Eligibility criteria for the gap payment includes that you are a healthcare card holder or you have an entitlement to Family Tax Benefit A. Our clinic will also consider a limited number of financial hardship cases each year. If you think you may be eligible for the gap, please speak to our team prior to your cycle beginning to determine what eligibility documents you will need to provide. To summarise, before you start treatment, please ensure that you verify your email address so that we can register you for the patient portal. Contact Medicare to ensure all family members are linked so you may maximise your entitlements under the extended Medicare Safety Net scheme. Ensure your GP referral is valid and is dated on or prior to day 1 of your menstrual cycle. Ensure you have prescriptions from your fertility specialist for all medication required for your treatment. And where applicable, provide documentation to demonstrate eligibility for gap payment. Remember, our team at Westmead Fertility Centre are here to answer any questions or address any concerns you may have before, during and after your treatment, so please contact us through the patient portal on our website, and one of our team of experts will contact you to provide assistance as soon as possible. We thank you for choosing Westmead Fertility Centre, and we wish you every success with your treatment.